So, hi everyone. I am with Dr. Priyansh Jain, who is delivering lectures on FMGE, especially on internal medicine. So, we have already covered too many interaction rounds with the students who are attending his events, and we have received wonderful feedback for you that you are really doing well. I want you to let us know your education qualification first of all, and other than that, since how many years you have been teaching for FMGE?
I have completed my MD in internal medicine from Geomedi Medical College, Rajasthan. And since 2015, I'm in this field, so it's almost 10 years now. Being in the field of teaching for FMGE as well as NEET PG exam.
Okay, so you're preparing for NEET PG as well.
Yeah, I have delivered lectures for NEET PG also.
Okay, so you have been associated with some coaching groups as well.
Yes.
Arise.
Yes.
Okay. So how the coaching and you because it's you're coming to Georgia. So is this your first time here or you are coming here continuously?
At Arise, we are regularly coming to Geomedi and we are also organizing classes here for FMG. We regularly come here, and I also came earlier also just to visit around Tbilisi. It's a wonderful city. Being here always is wonderful.
So how is your interaction in general with the students? Like, do you see any potential in them? Because when in India, when we talk about FMGE, people, they have a very negative mindset. They just say that if a student is studying in abroad for MBBS, chances are very unlikely that he or she would clear FMGE. So what's your viewpoint on that?
It's completely wrong. They are very well-learned students, and it's all the students that makes the difference. It's not about India or abroad. You may find some students in India also, they don't do anything, right, once they get into medical college.
Correct.
And it's in the college, it's not like schools, right? You have to show that you want to learn the things. But now, whether it's Georgia or India, if you show, they will teach you. But if you don't show, no one will teach you. So it's as simple as that. And there are many wonderful students are here, same like India also. So whenever I take lectures in Indian Medical College or whether it is abroad, all the types of students are there. So very good students, average students. So it's not about the college or the place which is making the difference. It's we need to come out of that thought process which was there 20 years ago, that the abroad is so and so stigma, but it's nothing like that. They are equally at par with the Indian graduates, and the level of the exam that they are taking, it's not just a basic level of exam. It's a very high standard exam which they are clearing, and the pass percentage, the recent ones, the newly fresh graduates, they have very good pass percentage. Maybe sometimes there are few cities there is 50, 60, 70% the pass percentage is there.
Okay, so how do you compare FMGE with other licensing exams like USMLE?
The good thing about FMG is it's a single shot exam. So you pass, you're done. And it happens every 6 months. But when it comes to MLE, there are 3 steps. Plus, it's a long journey. You have to do some clinical rotation. You need to go to US. You need to invest the money again, and it's tedious. The reward will come, but it's tedious. It takes 2 to 3 years, and there is an investment of 10 to 15 additional rupees has to be invested. So, I feel that if you are in second, third year and you're planning for MLE, it's wonderful. Go for MLE, because you can give the MLE even after completion of second year. So when you are in medical school, give your first step and step 2, and then just after the clearing your graduation, go to US. But once you have completed all that, then now USMLE is very long path after that. So it's better you go for FMG and you clear your NEET PG exam, and then you go for some other licensing exam. Say for example MRCP is very good. It's worldwide accepted. Except of US, you can work anywhere in the world.
Okay.
So, and all the steps occurs in India only, and it's not very difficult also. So if I prepare for FMG, then MRCP is not going to be difficult.
Okay, so does the Indian medical graduates also appear for such exams?
Yeah, they do.
Okay, so what should be the ideal age of start preparing for FMG or for any other exams?
It's always the early you start, early is better. So जब जागे तब सवेरा, आज से पढ़ो, आज से ही अच्छा है. So even if you are in first year and you start today, then you have to invest less time. Yes, maybe every day 1 hour. If you start in second year, you may have to invest every day 2 hours. This is a simple rule. If you start in third year, every day you have to read 3 hours, then 4 hours. So the late you will start, the more energy you have to put. The earlier you start, less energy.
Exactly. So as per your experience with this event which is happening with the University Geomedi, what do you think the students, about the students, like they are from 4th year or 5th year?
No, I have not got your question.
Actually, I just wanted to ask, like, because since the students they are coming from different universities and they must be from different years, so in generally what the interaction which I had with the students, so mostly were from fifth year or from sixth year. So are there any group of students who are from second year or maybe third year?
I don't think so. That's no one, I think, from second year. But I have not specifically asked also that is there anyone from second year, but mostly they are from pre-final year. But the atmosphere in the classroom is wonderful. They are super energetic and they are answering also very well. It's not that when I go and take the class in Indian lecture halls also, almost the similar. Means it's not that here the students are very dull or they don't know anything in the last 5 years, they are completely lost. It's nothing like that.
Okay, so does the similar kind of preparation happening in India as well? Like, because since we are very familiar about the next exam, so it may likely to
Currently, there is no as such in the Indian medical schools. There is no such classes on the regular basis happening. Nothing. In the internship, they start preparing for NEET PG exam. Since the next guideline is not there, when it's going to happen, not going to happen, no one knows. So the Indian graduates, they mainly prepare for the NEET PG exam during your final year and the internship year. Otherwise, no. Focus on the university exams. But yes, here the students they know they have a clock that they have to appear for FMGE exam. Even in the second year, third year, they start doing that thing. So it's good.
So do you think 1 or 2 years of preparation is enough for FMGE?
Yes, it's quite enough. It's very much doable. It's not that difficult. If you have a correct mindset, correct guidance, it's quite achievable. And I want to say to all the pursuing parents who are childs are pursuing actually the NEET UG exam, I would suggest that abroad is not at all as a bad choice. Provided that your child remains on the right track, disciplined, you know them better, and if they are disciplined, it's a wonderful choice to have. They will just not learn medicine, they will learn life also. Here when you come, you see a new culture, you see so many new things, right? A new language, a new atmosphere that grows, that maturity that going to come. Many of the time it's missing in Indian medical colleges.
Yes, and when we especially talk about the private medical colleges, so yeah, it's missing there. So, any other thing or any other input you would like to add?
See, whoever is listening to all these parents where the children are preparing for the NEET UG exam, I would suggest that the dream which you started with in the 11th class, you took the biology, and if by chance in the NEET UG your child is not able to secure that very high marks, 600 plus, 650 plus, don't shatter the dream with some other secondary courses. They are not any day equal to MBBS, right? So when we took the NEET UG exam, we had a dream that no, I have to do MBBS. Let's pursue this by this way or that way. And once you clear this exam, you are equally good. You are equally good like Indian graduates. And if the students will work hard, they will clear the NEET. And I have seen many students, so they started their journey in abroad. They are doing the MD in India. They have done their super special in India, and they are doing for very prestigious institute like EMS also. So it's nothing nowadays. It's all equal. So it's all the mental perception that they are having. So we need to come out of that.
Yes, we have to change our mindset, especially towards the foreign medical graduates. Because I also feel the same. Because on a daily basis, we interact with a lot of students. They have this mental pressure, either from a family or from peers, that you should, get at least above 600 marks to secure an admission in India. But even if you are getting above 300 or 400, which I believe is quite a good score when we see the competition in India and considering the number of students who apply for NEET UG every year. So you are doing pretty well, and you should choose good colleges, because in abroad, especially when we talk about Georgia, there are many good colleges coming up who are providing you wonderful resources. Like just has mentioned that he is giving coaching for FMGE since past 10 years. So you will be having some resources which can be a great motivation for you so that you could prepare well for the FMGE exam. So thank you so much, sir, for your wonderful input.